So Georgetown County, South Carolina has a serious problem with fentanyl. Okay. And I'm saying Georgetown County, South Carolina in particular, because Georgetown County, South Carolina is number one in the state of South Carolina. Now, I do completely understand that there's a fentanyl crisis going on across America. So I know Georgetown County is not exclusive in this, but there has been a crazy set of events that's taken place over the last couple of days in Georgetown County Detention Center of all places. And I'm going to let you hear from the sheriff of Georgetown County updating. And what happened is two inmates were found unresponsive, and they ended up in the hospital where one of the inmates ultimately died. And it's suspected that they were given fentanyl. But I'll let the sheriff talk to you a little bit about this, and then I'll give you some of my thoughts as to what is going on. Here is Sheriff Carter Weaver from Georgetown, South Carolina.
15th, around 5:56 p.m., Kelly Lambert was booked into the Georgetown County Detention Center. Correctional officers processed her at the booking counter, and she was put into population, where she came into contact with Alicia Childers and Shelby Ashby, two inmates currently serving a sentence at the Georgetown County Detention Center. Sometime after, Alicia Childers was found unresponsive by correctional officers, and Georgetown County EMS was called to the detention center to render aid. Subsequently after that, Miss Ashby was found unresponsive, and EMS also attended to Miss Ashby. Both Miss Childers and Miss Ashby were transported to Tidelands Health in the city of Georgetown. Miss Childers was treated and released from Tidelands Health, and Miss Ashby remained at Tidelands Health until this morning. I met with her family this morning here at my office, and they advised me that she has died as a result of the incident that occurred Friday night. I ordered 2 investigations on Friday night after this incident occurred. One was an administrative investigation to show how anyone could get contraband or an illicit drug such as this into inmate population. The other is a criminal investigation to hold any and all persons responsible in this matter. Kelly Lambert, to date, has been charged with bringing a controlled substance into the facility and also with contraband. The criminal investigation will also include any misconduct that was performed by my staff during this process. One of my duties as sheriff is the care, custody, and control of inmates, and that must be done in a professional manner. It must be done according to policy. It must be done according to standards, and it must be done according to law. The investigation is ongoing, and I will notify you of any new developments.
All right, that is Georgetown County Sheriff Carter Weaver, and he said he was going to update us. A lot of questions. I got a lot of questions as to, of course, he said, he's launching an investigation as to how the drugs got into the jail, any breakdowns in his staff. Now, I don't necessarily think he should be investigating that. I think an outside agency should be investigating. So you tell me what you think. Do you think that Carter Weaver should be investigating himself, essentially? A lot of things. Now, he brought up some names. First name he brought up was that of this lady right here, who is Miss Kelly Lambert. And Miss Kelly Lambert apparently was what's called a weekender. She was serving weekend time. Which means she had some low-level offense, and she was allowed to go home during the week, to work or whatever the situation is. But that's Miss Kelly Lambert right there, and Miss Kelly Lambert is the one who is been charged with bringing in the illegal substances into Georgetown County Jail. Now, the two people that he said she came in contact with. One is Miss Alicia Childers, who's being held there at Georgetown County. Now, the sheriff said that they're serving a sentence there, and I don't know if he misspoke or whatever the situation is, but and I'll tell you why I said that in a second. And here is the young lady who lost her life. Prayers to her family, Miss Shelby Ashby, who is 23 years old. Miss Childers is 34 and Miss Kelly is 45. Relatively young people, relatively speaking, especially Miss the young lady that lost her life. Now, these folks were being held in Georgetown County Jail. And the charge that Miss Ashby was being held on was a accessory after fact to murder, and Miss Childers is being held on some type of murder charge also. Now, Miss Childers apparently recovered from the overdose and is back in Georgetown County Jail right now. And so I was looking at this situation, and I found some comments that I found quite interesting. One was from this lady's daughter, this lady being Miss Kelly Lambert. Her daughter, got on and Facebook, and she was talking to her mom's friends. And so here's Miss Tiara Dyson. And Miss Dyson, if you happen to come across this, please reach out if you want to talk. I think you have a lot of insight that you can offer a lot of people, because I've been screaming this. If you've been watching me for any length of time about the crisis that is fentanyl in Georgetown County, South Carolina, and I don't think folks really understand. I think this kind of illustrates the point when you got two inmates that pass out in the jail, right? And so Miss Dyson says to Kelly's so-called friend, and that's her mom, don't come to me saying that's your mother. You shouldn't treat her this way, because I'll tell you to look up public DSS records and court records since 1998 on how she's done us kids. So this is Miss Lambert's daughter responding to the people on Facebook, because apparently she's had something negative to say in their view, from their perspective, I guess. I don't feel sorry for Kelly. She made her bed. Now she needs to deal with the consequences. I hope Kelly gets the full max of this, and the officers who fail to do their jobs. All I can say to people, Kelly has affected. All I can say to the people Kelly has affected, I'm sorry, but y'all know the risk when y'all do the drugs. And this death could have been avoided if Kelly didn't bring the drugs, but also if the officer would have done their job and properly searched the inmate as they were taking this person in. And it sounds like a case of familiarity breeds contempt. Now, I want to know, how long was Miss Lambert on weekend time? How long has she been doing this? And because that would give me an indication, that would give me an idea whether or not she has a system. She saw the flaw in it. She was able to finesse them, whenever she came in. She was able to play it low key and keep eyes off of her. I'm interested in knowing that. And then also, again, you can look these folks up. You could just Google Miss Childers' name, and it comes up, what she's involved in, apparently charged with the death of two elderly folks. You can go and look up that story for yourself. But this lady right here, Miss Yvonne West, she was speaking to Shelby, the 23-year-old that lost her life. Shelby, I forgive you for taking my son's life. I'm not the one to judge. God is. It's in his hands. I just know I love maybe she was trying to say, I have a painful life and it will always be painful. I don't know the situation, why they killed my boy, and never will know that pain. I will live with that always. Carter Weaver and his law did a shiny. I don't know. I don't know if she was using shity job investigation, or I don't know. With my son case, I don't care for him, and never there is no faith. So apparently, this is the mother of the person who Miss Shelby, the young lady, the 23-year-old who lost her life. Apparently, this is her mom, his mom, responding to the death of this young lady, saying that she doesn't hold anything against her. And I understand where she's coming from. A parent who's lost a child, so I can definitely sympathize with her. But fentanyl is a big problem in Georgetown County, big problem. And I've been talking about it from my platform. You know, they've been doing different things. Now, as far as the sheriff is concerned, now I had an issue back in, and I didn't realize it was that long ago. That much time had passed. With they did these forums in Georgetown County, but they did the forums in parts of the county where I'm just like, why didn't they, why didn't they continue it? And I'm not saying that would have stopped this, but I'm saying that there is a very, 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 very bad problem with fentanyl in Georgetown County, South Carolina, and awareness could help save some lives, possibly. Okay, but back in this was from 2022, right? We're in 2024, early 2024, but this was a forum, and I took issue with this forum because I felt like it didn't cover enough of the county. Now, keep in mind, at this time, the time that this came out, I was reading the stats, and it was already confirmed that Georgetown County was the number one county in the state of South Carolina in opioid and fentanyl overdoses ending up in hospitalization, and not far from number one in overdose deaths. And what's I don't it's not crazy, but check this out. So here is this is from the Georgetown County Council meeting, and I encourage everybody to get out and go to these meetings because there is good information there. And it's a part of the county meeting where they do a what they call a nonprofit highlight. They highlighting the nonprofit organization doing good things in Georgetown County. And so this particular organization came up to speak, and this this is this just drives home the point in what I'm saying about Georgetown County, and that's why I bring up the point in the fact that the why has so much time passed? Why isn't there more things being done on the information and passing out, making people aware of what's going on? There is a crisis. There is a crisis. People are dying. Okay, and but these ladies were there, and they just as a couple 2 weeks before the incident that just happened.
I wanted to, some of y'all may recognize me. I actually was the person, and I was recently given an award by Chief Brock and the mayor of Myrtle Beach for leading the pathway for that study. So when I was writing the opioid study for Ori and Georgetown County, we actually, Ori was just reporting. And so we know prior to that study, there was no Narcan available. You had to actually go and get a prescription for Narcan. There was which was over $300. And again, we provide all these services for free. I thought it might be important tonight just to talk to you a little bit about some of the statistics in Georgetown County specifically. And these are from the latest numbers from DHEC. DHEC just released their report, and I pulled these statistics directly from that report. So if you look at all the counties in the state of South Carolina, Georgetown County leads the state, not per capita, just merely leads the state in the number of people who suffer from an overdose and go to the hospital. So Tidelands Hospital is overdoses, or people overdosing, or people just going to take an ambulance hospital. You actually lead the state in that number. In 22, which was the last year that numbers were reported, the 2023, excuse me, 2023 numbers are not out yet, but you were second in the state in drug overdoses, only second to Horry County. And as you know, Horry County and Georgetown County had the same solicitor. So last year you had 38 overdoses. Out of the 38 overdoses, 37 of those people died. Only one person lived. And this was another reason we really wanted to have the mobile outreach unit, because we knew that with it being there being so many rural areas, it's very difficult for the police department, the EMS.
And let's just be straight up and down. This is affecting a lot of low income, poor white people. That's who it's really. I mean, it's ravaging. And I don't know, maybe it's the same type of things that went on during the crack epidemic. Is that uh, it's not a cool thing to have a family member that's addicted to crack. And I'm quite sure there's the same thing going on with opioids. But this thing here is both are horrible. But this thing here is a little bit different, and that's just my opinion.
The fire department to reach some of these locations and to save these lives. And many times they might not even be called until after the fact. Us having this mobile outreach unit and making Narcan available and free to everyone allows them to practice harm reduction within their own home.
And she said earlier that the Narcan was $300 a pop, like just to have it to save somebody. Like, there's a problem here.
Such as having a fire extinguisher. Like we all have a fire extinguisher in our home. And a lot of people don't understand the concept of it. But one of the things that I've heard Corey say, who is in recovery for 8 years now from opioid use disorder, and who actively works and makes great contributions to the society, and is a certified peer support specialist.
And the word harm reduction, again, that's going to be part of a bigger conversation, another conversation. But I agree with their work to a point. I'm not fully on board with harm reduction, and it's probably because I don't know any better.
Former student, I could go on and on about her. She talks about how we all practice harm reduction efforts every day when we put our seatbelt on, is to reduce the amount of harm that can happen.
And that was kind of like a sleight of hand to me when she said that the comparisons are not quite the same. I get it, but not quite the same. And harm reduction has to do with providing people who are suffering from addiction with different things, like and she'll get into it, the fact that they provide Narcan to folks leaving J. Reuben Long jail.
Us. Talking more about these 38 overdoses that occurred with 37 people passing away. 25 were from fentanyl, 5 were from heroin, 1 was from methadone, and 6 were from cocaine. And again, only 1 lived. And so if you look at the ones that were not from cocaine, those people had the potential to live if they'd had Narcan available. I also want to point out, I think there's a lot of misconceptions about the use of Narcan. When we give Narcan out in our office, we're begging people who are using to take the Narcan. They don't want the Narcan. Most of our Narcan goes to community members, people who own businesses, caretakers, and family members. This is not something that people like to use, but they do not like to use Narcan. It causes a lot of long-term effects and severe pain. Well, Georgetown County was second in issuing prescription drugs, and we know that a large number of our aging community are also addicted to opioids.
Georgetown was second in the issuance of prescription drugs, and then you wonder why Georgetown County is number 1 in opioid abuse.
Pain medications that they have to take. 4th in the distribution of opioids, and 4th in the state in fentanyl. Next slide. We don't mean to be making y'all depressed. We're going to tell y'all all the hope that we're bringing. Again, according to DHEC, your numbers in 2020, you had 28 overdoses, and 26 of those were opioids. It went up 35.7% in 1 year. So again, 32 of your overdoses last year were because of opioids.
Where would we like to go? We would like to get into the rural communities, to those that are on home.
Look at this part right here, and then we're going to move away from this. It says, where would they like to go? Rural communities, hospitals, detention centers. So they're not in detention centers.
Those with transportation issues, we would like to take our services to them. The hospitals, we would like to work closely with the hospitals in providing peer support, Narcan to the individuals needing it, and possibly follow-up services. the detention center, as I talked about earlier, and assist first responders. Right now, we have current.
Wowzers. So that's what we got right there, ladies and gentlemen. Crazy situation. Maybe the county will come up with some more forms, and because this was back from 2022, 2021, 2022, 2022. All right. So get in the comment section, man. Let me know what you think. We will be restarting our live programming in about 4 days, 3 days. I think we got left on this thing. But in the meanwhile, please hit the like button, hit the subscribe button. Please hit that follow button if you don't follow me already. So whenever I do these videos, you'll be the first one to get it. Again, peace.